Well, hi, and thank you very much for joining us today for our Dental Professions Career Panel as part of 2021, which is weird to say, Health Professions Week Spring event. So I'm Elizabeth Johnson. I am the Director of Recruitment at the American Dental Education Association, also known as ADEA, and I'll be your moderator today. So we are very fortunate today to be joined by four awesome students, and I will give their bio in a minute. And they're going to talk to you today, about why they chose a career in the dental profession. So three of our panelists are current dental students, and one is a dental hygiene student, but also I think thinking maybe about dental school perhaps, but she can talk more about that later. So, we're getting a really fresh overarching perspective of the dental professions. I think sometimes people think of dental professions just as dentistry, but that's not true at all. There's a lot of different cool options available to you in the profession. So I'm really excited we can highlight several of those options today. So without further ado, let me get started to introduce our panelists. So Dustin Mueller is a second-year DMD and PhD student at the Medical University of South Carolina, James B. Edward College of Dental Medicine. When he applied, he was actually a non-traditional student, meaning many things. But in his case, he had a wife who was actually a dental student and now is a general dentist at Midwestern University in Arizona. And he also has two kids. So again, right off the bat, you can tell there's a lot of different ways you can get into the profession. You don't necessarily have to start right away after college. So Dustin, welcome. We have Dominique Oliver, who is a third-year dental student at Meharry Medical College School of Dentistry, and she's from Dallas, Texas. She received her undergraduate degree from Arkansas State University, where she also lettered all 4 years on the women's basketball team. Very cool. And after completing her dental school, she'd like to pursue a residency in pediatric dentistry. So Dominique, welcome. So Caroline Chung is a third-year dental student at NYU College of Dentistry. She's originally from Houston, Texas, so two Texas people, and she attended NYU as an undergraduate student. And last but not least is Hillary Huss. She's a senior dental hygiene student at Central Community College in Hastings, Nebraska. She's graduating this May, but in addition to graduating with that degree, she's also pursuing an Associates of Applied Science Dental Hygiene degree. So she's getting 2 degrees, one from the University of South Dakota and the other one from the Central Community College in Hastings, Nebraska, which is very impressive, Hillary. So thank you very much for joining us today. So a couple of things before we get started. One, if you could please just keep yourself muted. I know sometimes people forget, but the background noise it can be distracting. So we appreciate that if you're not speaking. As we talked about already, we are going to be recording this. And so if you know somebody who couldn't join us, but is really interested in dental professions career, please share this with them. It'll be available on the Health Professions Week YouTube channel. So definitely encourage you to review this or share it with other people. And last but not least, but certainly the most important thing, please send in questions. The panelists, we left time deliberately at the end of this to answer any questions. Please use the chat function that you'll find at the bottom here. That's the easiest way. I'll monitor those chat questions and I will, relay them to the panelists and they can answer those questions. So please send them in at any time. We will wait to the end to actually answer questions, but you can send them in at any time. So I will, as I said, be monitoring them and be ready to start the question and answer after we finish our questions. So without further ado, let's get started. So Dustin, I think we're going to start off with you. So the first question, and this will be to all panelists, what helped shape your decision to pursue dentistry? Is there a story behind it?
Yeah, so I actually was not even thinking about dentistry in college. I'll fully admit that. I'm a late bloomer, if you will, in terms of dentistry. And so it wasn't until my wife went to dental school, and granted, I always made fun of her for wanting to work on people's mouths. And then I actually started shadowing dentists, and it turns out it's really cool. And so it ended up where at Midwestern, when my wife was there doing her dental school years, I got the chance to do research in the dental laboratory that they have there, and got a chance to really work with some of the faculty, work with patients on some of their clinical trial stuff. And so it was one of those things for me where I really fell in love with it once I actually started looking into it. And it was a shock for me because I never necessarily anticipated dentistry being my pursuit in life, but I've really enjoyed it. I'm finished up my first year of dental school, and now I'm in my PhD year. So I'm doing full-time research now, but I've really enjoyed the dental school process.
Great. Thank you a little bit. And Dustin, this is a little bit of an aside. Can you talk a little bit about, your reasoning behind choosing to do the combined, DMD PhD program?
Yeah, so I've always loved research, and I've also always loved teaching. And so for me, I've kind of always envisioned myself at a university, even before, again, dental school, teaching, doing research. And so when the option presented itself to not only be a dentist and see patients and really have that interaction, but also get the chance to do research and set myself up for a career teaching and helping students, it just made sense to me. There's also a bunch of other benefits. So like the DMD PhD, most of the programs will actually pay you and waive the tuition, which my wife went to dental school, which isn't always the cheapest thing. And so the fact that I could make my schooling free after we paid hers in loans, it was also a plus. But there's a lot of different things for me.
Get up and mute. Yes. Thank you, Dustin. I appreciate that. And, I think that's a good plug for, there are opportunities here in dentistry where you can, maybe find outside of financial aid, some opportunities within the school that pay for those. And, we can talk about all that stuff later, but thank you. That's great. Dominique, how about you? What's kind of your story? How did you get into the profession?
So my story is quite cliche, but I've always wanted to be a dentist. And so I used to live in Oklahoma, so I'm pretty sure it was either first or second grade that I had a classmate and her dad was a dentist. And they came to the school and just showed us how to brush our teeth, floss, and all this stuff. And I was a very nervous person, so I was always sitting in the back. So I just remember sitting in the back and, he's talking to us. And from that day forward, I always wanted to pursue dentistry. A few people try to persuade me differently because they're like, in the mouth, really? I'm like, there's nothing else that I want to do. So I've always wanted to be a dentist, and that's kind of my story.
There's nothing wrong with cliche, Dominique, I promise you. Nothing wrong with that. Thank you very much. Caroline, what about you? What's your story about your passion for pursuing
Yeah, hi guys. So a little bit about why I chose dentistry was growing up in Texas, my dad and I would always fix bikes. So I'd always be using my hands and really interacting with him. And I always knew that I liked to be around people. I love new conversations. I love cracking jokes. And my aunt also is a dentist in New York. So kind of incorporating two aspects that I really loved was using my hands and always learning something new, but also speaking to new individuals all the time. And so my aunt kind of inspired me to shadow dentists back home in Katy, Texas. I know it's a little far from where Dominique is, but both Texans. And I would watch the way that he would interact with everyone. And it was such a different story, and you learn so much about people. And I think that was also a big step as to why I came to New York. You really get to see so many different types of cultures and religions. And as a health professional, you're helping someone, but you're also learning so much. So really incorporating the two things that I really loved growing up with my dad and my mom, just doing things together and being around so many people was what really led me to dentistry. There's so many aspects you can do with it. So that was why I chose dentistry.
That's great. Thank you. That is the first time that I have heard anyone talk about being passionate about dentistry. It's stemming from working on bikes. That's very interesting. We talk about manual dexterity, working with your hands, being creative, but and you talk about kind of the things that you would normally think about, like sewing and playing a piano or, something else, but working, that's so fascinating and very interesting. Something I will talk to other people about. So that's great. Again, it's very interesting how people get into the profession, and that's a very interesting way to get into it. So thank you very much. Hillary, I'd love to hear, from you. Hillary is focusing on dental hygiene. Clearly you heard she's I don't know how she's doing it, but focusing on two, two degrees at the same time. I guess Dustin too is as well, but a little overambitious for me. I certainly couldn't do that. So tell us a little bit about your passion for dental hygiene, and maybe talk to a little bit about why you're, doing both degrees at the same time.
Yes. So I guess I'm kind of like Dominique. I have always known that I've wanted to be a dental hygienist ever since I was in high school. And lucky enough, the school I was applying to, you needed 40 observation hours with a dental hygienist. So being able to go and see for 40 hours what a dental hygienist does all day just really, really wowed me, like how she cared for her patients and just the treatment planning and just the overall health of the patient really motivated me to become a dental hygienist. And so after getting accepted into Central Community College, I was told that they have a dual program. So Central Community College is an Associates of Applied Science for Dental Hygiene, and they have a dual program with the University of South Dakota, and that is a bachelor's program. So you can do both at the same time and graduate with your associates and your bachelor's of dental hygiene. So I decided to do the bachelor's of dental hygiene because it just gives you more job opportunity just all around the world. So
awesome. Thank you. Yeah, and I think I got that mixed up. My apologies, which degree you were getting at what school. So sorry about that. Well, thank you so much. I think we've just kind of started on this panel, and you can already see from attendees, I hope you can see how diverse, stories are and people's background and how they got inspired to enter the dental profession. So again, I love talking to students and finding out their stories. It's always fascinating every single time I talk to new people. So thank you. So, really when, I think attendees here are starting to think about the profession, they might have, decided on it, but most likely not. They're kind of exploring our options. They might be looking at medicine, they might be looking at nursing, they might be looking at a lot of different things. So, when you were deciding, even if you were the cliche Dominique and knew you always wanted to do it, what questions did you ask yourself when you were deciding, if the dental professions, dental hygiene or dental school was the right career fit for you? Dominique, Miss Cliche, we will go with you first.
So I'm always been a person, I always am inquisitive about what it is that I'm doing. So I was still, questioned it, even though it's like I've always loved dentistry. I've been scheduling my own dental appointments since I was like 10. I still, in high school, we had a program. It was some sort of medical rotation program where they went to the hospital, but I still was like, this is still a medical field. So I signed up for the program, but without telling them I was interested in dentistry. And then I went to the teacher and I asked her if I could go on my externship my junior year instead of my senior year. So you could drive yourself to whatever externship it is, and it's like half of school. So I presented it to her and I presented what office I wanted to go to, and she liked how I had all my stuff together, and I was able to jump a year up and do my externship my junior year instead of my senior year. And so then I was able to shadow an office 3 days a week, I think, in high school. So for a whole semester, no, trimester, we were trimesters. So it was about a month and a half maybe. And that's what solidified it for me. And then I started shadowing my dentist, and I was his first patient that has actually gone this far into pursuing dentistry. Most stop, because they figure out like, oh, the loan, the time in school. So in high school is when I definitely solidified it by going to shadow and in high school.
Thank you. And so Dominique, I do have a follow-up question for you. I think, certainly on our end, at ADIA, we talk very heavily at this stage about the importance of shadowing. So, really the critical, thing that somebody who's interested in the dental professions needs to do is shadow. So maybe you could talk just a little bit about maybe some of the questions that, I know you already knew you wanted to do it, but maybe the questions that solidified your choice. Some of the questions you asked the dentist that you were shadowing, whether it's your personal one or the first, that in the externship, what are some of the questions that you asked the dentist that really, solidified your choice? Again, I know you already kind of knew, but, really double solidified that choice. If you could just maybe tell the attendees some of the questions you thought were important for them to ask.
So it was important to me to figure out what the day-to-day life was of a dentist, because it is a stressful field, and it can be a stressful field. So it was very important for me to ask, okay, so what does your day look like? How do you schedule family time? At the time, it was a male dentist that I've actually only shadowed male dentists. So I haven't really gotten the female perspective, but I have an idea in my mind of how I would like to practice as a dentist, either private practice or work as an associate. But I like how they have always, the first thing that most dentists say is like, I can set my own schedule and I can, just work off of when I want to work and how I want to work. So also the autonomy of the field. So there's so many different ways to do everything there is a wrong way to do things, but there's so many right ways to do things. So I like how, you can have your own kind of spin on it, especially if you're artistic. So a lot of them mention that they have a lot of artistic background. So for me, I like to do pottery. I've been doing it since college. I did it, just to, I guess, stand out on my application. And now I have like a pottery wheel in my garage here. So it's something that I fell in love with. But so I just wanted to know what the day-to-day life was, how they managed their office. And I liked that. I like, especially coming from a female standpoint. I want a family. I want to be a wife one day. So those things, it just aligned with the life that I wanted.
Great, thank you. Yes, I think a critical question there is what does the day-to-day look like? And certainly every day is a little bit different, right? Which is, I think, makes the field very dynamic. You have even though you get to know your patients, they sometimes come in with something totally off the wall and you're like, what? And you have to deal with it, which makes it kind of a cool profession. But, there is some semblance of a day-to-day. And I think that's very valuable question to ask if you're shadowing. So thank you. Caroline, how about you? If you want to talk a little bit, whatever aspect of this question kind of makes sense for you. If you want to talk about shadowing or, what kind of questions did you ask yourself when you were figuring out if this was the right path?
Yeah,
for
absolutely.
you?
I think when I was kind of deciphering, I always wanted to be in kind of the health professional field, and dentistry for me was also early on. I always loved the idea of having flexible hours and, like Dominique was saying, the autonomy. But for me to really decide why dentistry was, you're helping save lives by prevention and not necessarily in a surgery. When you're doing surgery, it is kind of life or death. And for me and my personality, that's a little more intense. And I think it's really heavy on the heart. But with dentistry, you don't really see that almost, I don't want to say ever, because I know it's very different, but it's very rare to see something that will lead to a really hard conversation. I think you also see results pretty quickly. I know some, procedures will take 6 to 8 weeks, months. Well, that's a whole different story, but you see what you're doing right away. And when the patient really reciprocates it back, it's such a good feeling. As a third-year student right now, so I'm seeing my first patients, and we're kind of doing it with our D4 students, and they're really assisting us and helping us kind of get into the groove of things. And you'll see kind of the patient say, hey, thanks for actually listening to me, or hey, you're actually talking to me. And most dentists just kind of ignore and just try to drill my teeth and whatever, and they leave. And I think that personal aspect was something that I really wanted to ask the dentist, am I a good fit? And I think what really helped me also was asking my parents and my friends. They know me the best, just kind of knowing my personality and how to engage that into what profession. So that was the biggest question. And the second thing that I also really liked, aside from, hopefully starting a family one day and being a wife and a mother, all of those things, I think the biggest thing is that I wanted to kind of have a profession where you're constantly, it is different every single day. And the foundation of dentistry is the same, but you're always learning something new. And I think if you can see yourself as someone who wants to continuously learn and wants to continuously teach others, I think dentistry is such a good field. You're never bored. I think that's the best aspect too. And there are challenges and there are stresses. I think we all know it comes in waves, but at the end of the day, when I'm talking about what I do, I get so excited, and I really, really am grateful for it. So those are kind of the two big things that I asked myself kind of going into the field.
Thank you. I think that's a testament to you choosing the right field. If you're excited about it at the end of the day, every day, even though there's, excuse me, some challenges, being excited about your profession, that I can sense that from you. So I'm really glad you found your right career fit. We're gonna go over to dental hygiene for a minute. Hillary, I know you already kind of talked about that 40 hours that you spent. So maybe you want to share a little bit about that experience and maybe some of the questions you asked in that experience and other questions you asked yourself about whether dental hygiene was the right fit for you.
Sure. So on those 40 hours, we were able to see the dental hygienist treat many patients, and just seeing how she interacted and the type of personality that it kind of takes to be a dental hygienist, because you need to connect with so many different personality levels. So I guess a question I asked myself do I have the right personality to treat patients with all different types of personality levels? And I think it was really cool to see in those 40 hours how she interacted with different types of people. And I really learned a lot with each personality level. There's some that are stubborn and there's some that are so kind, just like being able to work through it and educate those with all different types of personality levels. So that was fun.
Yeah, I think that's a very valid statement. And I think, as a dental hygienist or a dentist, you're faced with, varying personalities and levels of, unfortunately, fear. There are people who come in and are a little fearful. And so, being able to get exposure to that, I think is critical. When I talk about dentistry with other people, dental professions, one thing I emphasize is, yes, science is important, math is important, all of that stuff, creativity is important, but, communication is even more important than all of that stuff. So, to build the rapport, to build that relationship, whether you're a dental hygienist or a dentist, that is key, to having your patient come back and listen to your advice if it means you have to do a little bit of extra work, So I'm glad you mentioned that, Hillary. I think the personality types and experiencing that is extraordinarily important, because that's a very important component of this profession and health professions in general, but certainly for dentistry. So thank you. Dustin, I did not forget about you. So, please, you have a very interesting background. So you obviously knew about dentistry through your wife, but it might have, maybe at the beginning you weren't sure, and it sounds like maybe not because of financial stuff or other things. So maybe talk through kind of that decision making process of how you decided dentistry really was the right fit for you.
Definitely. So one of the biggest things that I've told my pre-dental friends or anyone even sort of considering dental school is a lot of schools will have like impressions day or like a pre-dental day. And I did mine at Midwestern. I've helped here at MUSC with their Impressions Day, and honestly, it was a big thing for me. So like at Midwestern, like they showed us how to place implants. We got to prep a tooth. We got to meet with admissions committees, and just got to meet a number of the faculty and started really talking to them about what is the day-to-day of a dentist. What is the day-to-day of a dental student. Dental school, especially those first 2 years, are typically very intense and very stressful because it's a lot of classes and a lot of things stacked on top of each other. And so, considering dental school from the dental school side of things, I'd absolutely recommend, doing one of those if you can. I know too, right now, in the days of COVID, where shadowing isn't always the easiest thing, I'm personally a huge fan of YouTube and Instagram. There's lots of dentists on both of those sites who post pictures and post videos of the things that they do. And that was honestly one of the kind of big eye-opening things for me is once I kind of started thinking like dentistry might be something I was interested in, all of a sudden I'd find myself on Instagram for like 3 hours looking at like the different preps people were doing or the different like cosmetic procedures. Then you look at like before and after pictures and I'm like, that's amazing that you can take like a mouth that, clearly just doesn't look great, or, maybe there's something that the patient didn't like. And then just, you see that smile on a patient's face, when you're done. And that was a huge thing for me. And then just the sheer fact, kind of like everyone here, I've kind of always known healthcare was sort of the direction I wanted to go. But one of the things that I really love about dentistry is chances are you're going to see your patients every 6 months. Whereas a physician, you really only see them when there's something wrong, right? And so the fact that they come in for a cleaning every 6 months, it gives you the chance to really get to know those patients and get to know those families. A lot of times, like especially with my wife, I get the benefit of watching her in her first couple of years out now too. She talks about the fact that, 2 years ago when she first started, she's seeing those patients come back and she knows their family and she knows what's going on in their lives, and really being able to connect with patients that way that you maybe don't see in some of the other medical fields was a really big decision maker for me as well.
Thank you. Thank you for bringing that up. That seems to be a theme, which is, of course, true. And something I certainly talk about when I talk to students is, if that relationship building part is very is relevant in this profession, dental hygiene, whether you're a dental hygienist or a dentist, it's, your part of your job is building that relationship and encouraging somebody to come back every, twice a year, so they don't have any issues, right? So I think that's really valuable, and something, anyone on this, attending this webinar or watching the recording, definitely think about the things that our panelists are talking about. I think, depending on your level of engagement and how involved you want to be in a patient's, not just their oral care, but their life, in general, and building that rapport and relationship, dentistry is really the dental field is a really unique, I think, field in that way, because you're right, you get to, see people on a more regular basis, and not just when they're, not feeling well and dragging themselves into into their, GP's office. So awesome. Thank you so much. So, again, I work for an organization that provides resources to, students thinking about a profession in dentistry. So, a big thing for me is, resources. So, what types of resources did you consult? It can be people, obviously. It can be online videos. Dustin, you already talked a little bit about that. Obviously, anything Adia produces, we'd love to hear that too. But what are some of the resources that you consulted when you were, making that decision about, the dental professions being your career? Hillary, why don't we start with you?
Yes. So a big resource was I knew someone who was a dental hygienist. So from there on out, she was kind of a mentor for me. Any question that I had about dental hygiene that I had in regarding to the profession, or just anything closely similar, she kind of mentored me through the applying to dental hygiene school, the prerequisite courses that we needed. So I would say the biggest resource is just trying to find someone in the profession and kind of ask them to be your mentor, and just ask them any questions that you have before you get involved in the program. So.
Thank you, Hillary. And I think that's very, it's important here to kind of make a distinction between somebody you might shadow and a mentor. So, a mentor really is somebody who will, you have that relationship with long-term, years and years and years, somebody who's willing to commit the time, and, really you're able to ask them a lot of things. Sometimes it might be a personal, question. So shadowing is a little bit different. That's more of a limited time exposure. So just I'm glad you mentioned that, because I think that's very, very valuable. So whatever career you decide, I think a mentor is key. Certainly it's been key for me in recruitment. So thank you. That's perfect, Hillary. Caroline, why don't we hear from you? What resources did you rely on when, deciding dentistry was the right fit for you?
Yeah, I think the biggest one was the dentist I actually shadowed. He was someone that really got to know me because I would go in almost every day in the summer of high school. So I went during the junior year of high school and even senior year before I went to NYU. And I remember just sitting with him and asking him a bunch of questions. I feel like at the time you feel like it's so early and you're like, I'm not applying for another few years, but it really creeps up on you. And I remember just sitting down and asking, can I incorporate, different hobbies with dentistry? Because this is kind of ironic, but I didn't always love the sciences. To me, they were really hard. It was challenging. We all got through it, but I also really liked to write, and I really liked engaging that way. So I was asking him, although the sciences are the basics and you have to do really well in those, is this profession able to kind of incorporate all the things that I do like? And he was the first person who was like, yes. He's like, I have time to go fishing. I have time to write. I speak at different conferences. And because of that, even to this day, I'm able to do that. So at NYU, I actually started an NYU Dental Journalism Club. And so we'll have student dental writers who write pieces on different pieces each month, whether it's about COVID or wellness, or even, incorporating interviews from high school students who want to do dentistry. So I think him telling me that way back when has really inspired me to, although, really, really study hard and take boards and all of that, but also incorporate something that I never thought I could with dentistry. So that was what I really, really am thankful for, that he taught me.
It's very interesting. Yeah. And I'm glad you had somebody who, was pushing you in that direction. Sometimes it can be challenging to find somebody like that. So great. So far, mentor is the way to go. Okay, let's see. We don't have to have a different answer. That's okay. If mentor is it, then that's the takeaway here. Dustin, how about you?
Yeah, so when looking at schools, I'll make a plug for y'all that DIA Dental School Explorer thing, the book as well as the online component, was awesome. I cannot recommend it enough in terms of figuring out A, what schools exist, and B, different things like GPA ranges and DAT expectations. As well as class size. There are some schools that have very large classes. So for instance, my wife, her graduating class was 140. The school I'm at, it's 70. So, gives you a different kind of perspective on how much you're going to see some of your professors sometimes. Some of the other things, pre-dental clubs, even if your school doesn't have one, honestly, if you reach out to kind of any of them, I reached out back to North Dakota State, which is where I graduated, and, reached out to our pre-dental club, as well as, the University of Minnesota, since I'm from Minnesota. I had some friends there and asked them what resources they had. And that was super beneficial because they were able to, connect me, whether it was studying materials for the DAT or, different people to contact in terms of shadowing or internships and externships and different things like that. So that was really big for me. And then one other thing that I really enjoyed once I really started looking at dentistry is, again, kind of make a plug for that, the dental school day. I was able to meet some of the dental students there and really and they gave me their email, which was very nice of them because I absolutely bombarded them with questions through email. And ask them, again, what's your day-to-day like? Why did you want to become a dentist? I think my reason is a good reason, but maybe it's not. And, just kind of getting an idea of, what do they want to do? What do they see for the future? And really being able to see that. And again, it was one of those things where, much like, those Instagram videos and the YouTubes that I found myself getting sucked into, is, I really look forward to getting those emails and being able to communicate back and forth. And it was, every time I'd see the email, like I'd get a smile on, and, it finally started to click to me like, oh, like maybe this means this is the right moving forward for me. So that was kind of some of the big resources for me that I really enjoyed and were helpful.
Thank you for that plug, Dustin. I appreciate it. And speaking of class sizes, I think that's a very good, that's something, Caroline is at NYU, which the class size is 300.
Yeah, 330 plus. I know everyone's. Yeah,
I think NYU has one of the highest, I think. Yeah. Which is okay, which is great. There's nothing wrong with that, but it is very interesting that the schools are presented here, at least on the dental school side. I'm not quite sure for Hillary, but on the dental school side, it's a big range, and that matters, right? Again, obviously, if you can, dentistry is the choice that you're, deciding on. Those are also questions that you have to ask yourself, but down the road, not quite yet. So thank you. That's great, Dustin. And Dominique, how about you? What, kind of valuable resource did you rely on? I know, again, you're the cliche, and that's okay. But tell us a little bit about, some of those resources that you use.
So really in agreement with everyone. So, during our time when we were deciding on, whatever career we wanted, it was, you had to go out and ask people and speak to people and connect with people. So I found a mentor, which was my dentist, and I just have been sticking with him ever since. And that's, the route that I took. But if I had to go back, and if I had all the resources that all the young adults have now, which is YouTube, blogs, and whatever else, they have so many ways to look at the field before you even step into an office. I would suggest doing that first. And then if that somewhere sparks your interest, then just go into a dental office or email, call, connect with a dentist. Most dentists are totally okay with you coming to watch them. Most dentists are very chill and relaxed. They don't care, which is another reason I loved it, because I was like, wow, you look like you love your life. And I want to love mine too. Not that I didn't, but so some things that I also use, I use a few IDEA things. I was a very shy, and I'm still kind of a shy, nervous kind of person. So I didn't always just step forward and ask people things. Nowadays, you can just follow somebody on Instagram and, just, mention that you want to go into dentistry, and they can become your mentor. I know a lot of dental students do that. That's how I was able to get help with my application. Outside of the tools for IDEA, I just messaged a girl that was older than me, that was actually in my sister's class at the time. And she has helped me to this day, and she's still my mentor. So she's graduated now. She went to San Antonio Dental School. But so if I could go back and change, and I had all these things, it would definitely be utilizing social media, any online resources. And, it was already on the fast track for all of that, but COVID has truly accelerated all the different tools that students can use to see about the industry in itself, like as a whole, because, hygiene, there's dental tech, there's so many things that you can do, education. And then also I would suggest maybe shadowing all specialties if you can. I definitely had a one-track mind. I just knew I wanted to be a dentist, and that's all I knew. I had a flip phone, when I figured out I wanted to be a dentist. So when I got to schools, when I was able to actually see all the specialties, and dental school happens so fast. I mean, it's so fast. You'll look up and it's time to apply to residencies, which it is I know for myself and Caroline, we're both D3. So the application has already kind of, you're allowed to put some information in already as of now. And I'm just like, I still feel like a D1, but so I would definitely do that if I could go back.
Thank you. Yeah, I think certainly your comment about COVID accelerating some of this stuff is absolutely true. But yeah, I mean, it is, I'm going to try not to date myself, but when I was in college, and thinking about a career, not dentistry, but a career, all of the stuff that's available now was definitely not available, in those dark ages back when I was in college. So yes, I think, I think the ability to utilize technology in the best way possible. And, your first step right here is attending this webinar or watching the recording if that's what you're doing. So I think that's absolutely correct. And I, of course, would be remiss if I did not put in a plug for, events like Health Professions Week, which is coming up in November. So, that stuff happens every year. This is our 6th year, I think. So we've been doing stuff like this for a long time. So, there's definitely a lot of opportunities for career exploration. Obviously I'm going to plug dentistry and the dental professions, dental hygiene, dental assisting, all that stuff, because that's my profession. But, just getting a robust health professions pipeline is really what I care about most, is, because that is really the future. So thank you very much. So I shockingly have come to the last question, which I can't believe is true. But I think it's the most important question. And it's a question that I think is, it's that advice question. So, what is one or two pieces of advice you would give, a student who's thinking about a career in dentistry, but, not quite convinced it's for them, or, they don't really know where to look. I think we've all talked about a lot of places to look, but, if you could only give one or two pieces of advice and that's all the advice you could give, what would that be? And I also think, maybe think about it in terms of somebody who, is not sure that they have the grades, or they're not sure that they can find a mentor, or they're not sure they have that support at home. I think that's sometimes where students struggle, is they don't think they have that support system, whatever that looks like. They don't think they have the grades. So when you're, giving advice, maybe think about it from that aspect. What advice could I give somebody who feels like they're in that situation? Dustin, how about we start with you?
Yeah, so and just to take a couple of seconds here and give a little background about me. My first year of college nearly failed out. I just did not do well way back when. I was working 2 to 3 jobs. I was helping pay bills for the family. And so I very much understand and really, you know, connect with a question like this. One of the biggest thing is if I can make it here, I promise that any one of you can. And another thing is too, you know, if you look online, and as great as the internet is, you go to different websites and people are going to say, you know, you need to be, you know, have straight A's and you need to have this. It's not real. You know, you might think, you know, I've got really bad grades, but that doesn't always mean everything. And dental schools really look at you as an entire applicant. You know, they have their minimums in terms of, you know, GPA and DAT. And again, I'll throw that plug for the Dental School Explorer. Really, you know, once you get that interview, it's all about seeing, you know, like we've talked about earlier, if you can communicate with people. And so the big thing, you know, in terms of advice is, you know, think of yourself as an individual. You know, the scores and the numbers are great to give you an idea of, you know, what you maybe want to aim for, but it's not the be all end all. And, you know, you can continue to work, whether it's going to a master's, which is what I did to show that I could handle the graduate level courses, or, you know, again, being able to reach out to some dental students and just ask them, like, you know, what do I got to do? Or, you know, can you handle a family? You know, my wife had 2 kids while in dental school, and it was not the easiest thing in the world. And she is superwoman, far and away, in my humble opinion, because she was able to do that. And so, you know, able to have a family in dental school. You know, I have a wife and 2 kids, and managing time and all of that kind of stuff. Absolutely reach out to a dental student or, you know, a dentist, and just ask them. You know, we're a pretty happy, helpful bunch for the most part, from everything I've seen. So I think that would be a great way to go about it.
Thanks, Dustin. I appreciate that. How about you, Caroline?
Yeah, so I think I kind of have 2, but the biggest one that I wish someone had told me was that everyone makes mistakes and failures. I think you kind of forget that, and I think if you have a bad course grade, don't let that hold you back, but let that motivate you. Maybe try a different type of course or a different studying method. I think, speaking from personal experience, even my first year of dental school, it was really hard. There were so many presentations, so many PowerPoints really thrown at you, and I thought that I could utilize the same study skills that I did in college, and that was not the case. I had a bad exam. I really, you're really hard on yourself, and I felt defeated, and I would kind of ask myself, can I do it? And the answer is yes, you can. You always can. And I think if someone had told me, all of these dentists above me had also made mistakes, whether it was an exam or a practical or a procedure, whatever it was, and they're fine and they've learned from it, I would have been a lot less hard on myself. I think because of that, my second year, I found the best study habits. I actually began to really love the science courses I was taking while still incorporating the things that really I enjoyed. The second thing I would say is don't compare your journey to anyone else's. Again, I wish someone had told me that, because all I had known was you go to high school, college, dental school, that's it. But that is not even the case. And to this day, some of my bestest friends have applied multiple times. They've done different careers, and we're all doing the same thing. And I think I wish that someone had told me there's not a traditional way, because I was so hard on myself to having to get in this only kind of ABC pattern. And hearing Dustin, that's super inspiring. I don't know how your wife had 2 kids. I can't even take care of myself in dental school. But those are the 2 things. And if you ever, need someone to reach out, I mean, I'm sure all of us on the panel would love to talk to you too. You're never alone, even if your support system isn't as generic as you think. The best one is you, and that's cliche, but you really, really can do it, and you'll be great in everything you do. So don't let fear kind of dictate how you do life.
I'm taking that personally for my own career path, not into dentistry, just so you know. But no, that's great. Yes, I think we forget that we're our best advocates, and we can't lose sight of that. So thank you for that. Hillary, how about you?
Yeah, so I guess the advice I would get is don't be discouraged if you apply and you do not get in. So I applied to a dental hygiene school, and I did not get in the first year. So I was done with my prerequisites. So I went ahead and got a dental assisting job. So through that dental assisting job, I learned all the dental terminology and just what it was like to be in the dental field. And then the following year, I ended up getting in. So it's a very competitive field. Do not beat yourself up if you don't get in the first time, because I promise you there is a school out there that wants you. So
Thank you. I appreciate that. It is a competitive field, and every year you see, I've heard from applicants who are reapplicants, and they don't understand, what else they can do better. And sometimes I'm like, I don't know. Every year's a little different. Everyone, that's that. Yes, and then you get discouraged. So it's good to hear that there have been experiences where people haven't gotten in the first time. So thank you. And last and certainly not least, Dominique, how about you?
So first, I just want to completely agree with everyone that went before me. Their advice is A1. It's definitely like for me at my school, most of the students there are actually non-traditional students. Most have families. We call ourselves the Blueprint. Each class gives themselves a name. I don't know how many Blueprint babies that we have. We have one that's due this week, so she's going to be having her baby. We had one classmate, we didn't even know she was pregnant. She just had the baby, and we were like, how are you going to do this? But that was her third baby, and she just kept it rolling. I think the one thing I would say is be flexible with yourself. It was my thing was also, along with Caroline, I thought high school, college, go straight into dental school. That didn't happen for me. And then along with Hillary, I went and I was an assistant for a year. The 2 days after I graduated, I had a job. I just sent out my application, and it's a place called Dental Post that I found in college. And you put in your resume or whatever it fills, and you fill it out, and you just apply. And that's all I did for like 2 days, and I got a job. So, and like she said, I knew all the dental terminology. By then I was already, x-rays, all of that, and being just in somebody's mouth and next, because it's weird to be as close as we are to somebody's personal space. A lot of people are kind of scared when they first do that, especially when they're taking a handpiece to their head. It's scary. But because I had done that, not the handpiece, but I just been close to them, I was kind of used to it. So if you can just really get in the office, and maybe even the last year of school, or however you want to do it. I loved my gap year. I would suggest a gap year to anybody. One, you can make some money because dental school is mad expensive, and I avoided the ramen noodle year because I was able to save up and stay home. And then I got to just do things that I didn't get to do in college, being an athlete. I just loved my gap year. So if you're thinking that it's the only way through is to just go straight through, it's not. And I would honestly suggest you give yourself a year to just exist, because school will overrun you.
I think that's excellent advice. And I think attendees, I hope you can sense here that this traditional path isn't always the case. People take gap years, or you have to reapply. So there are a lot of different avenues to get into this profession, which really makes it exciting. I've talked to students who, spend 5 or 6 years in a different career and decided, to come back and pursue dentistry or the dental profession.
Most of my classmates that actually did go straight through are experiencing extreme cases of burnout right now. So, because dental school is very rigorous, it's so time consuming. COVID has allotted us a lot of me time, but before that, I didn't see my house. I only came here to sleep. That was it.
Yeah, I think that's very real. And certainly coming from if you're coming from a 4-year institution and trying to finish all those classes and taking a DAT, and then, it's busy. So if you have the chance and the means and the opportunity to take a gap year, I think that's a good option for a lot of people. So thank you. All this advice is wonderful. I'm certainly applying some of that to my own life. So thank you. Maybe not the gap year, unfortunately. I wish, but well, listen, thank you you guys have been amazing. Your stories have just been phenomenal. Your advice and, what you've been able to share with attendees is just great. So I'm going to open it up now for questions. And before I do that, Mandy from Health Professions Week, I'm sorry, I forgot to give everybody the link to check out HPW this fall. So quickly, it's explorehealthcareers.org /HPW. So explorehealthcareers.org/HPW. So sorry about that. Okay. So question that came in, and this is for everybody. What has been the most and least enjoyable subject to study in dental school / dental hygiene program? Does anyone want to raise their hand and answer that first?
I'll go first. I absolutely hated pharmacology. And I still do to this day. I mean, it is just so much. And then on top of it, I can't even pronounce 99% of these drugs. Like it was a difficult course for me. Because I'm not so memorization. I try to just understand it. And I just had a hard time understanding it, but I'm gonna have to attack it again for boards. But the next my favorite was dental anatomy. We call it dental anatomy and occlusion. I don't know if everyone else calls it that. And it also happens to be my initials, so DAO. But I actually enjoyed it a lot. It's the first class you get as a dental student that is just truly in your profession. You're like, finally, I'm out of these science classes and I'm doing what it is that I always wanted to do. So.
Awesome, thanks. Anyone else want to chime in here about? Sure, Caroline?
I think my least and favorite class was the same class, if that makes sense. So we took one our third year. It's called Oral and Maxillofacial Pathology and Radiology. So it is a mouthful. So we call it OMPR. And it is the class where you look at a lot of radiographs and clinically, and you look at kind of the diagnosis of pathology of what you'll see in the mouth. And it was hard. So I will say, like, you take 4 exams. The first one, not so good. The second one, okay, and then I picked it up. But I think now that I'm in clinic, I actually see what I will see on, slide 67 in a patient's mouth. And to me, that's really reassuring because everything that I learned makes sense. But it was so hard and so rigorous that I think I just hated it at the same time. So that was the course that I loved and hated all in one.
I don't think you're alone, Caroline. And not necessarily for that class, but I think there's classes that somebody hates and loves at the same time. So Dustin or Hillary, do you want to chime in here?
Sure, I'll go. Probably my favorite class was dental materials, which I'm a science engineering. Granted, I'm here for a DMD PhD. My PhD will be bioengineering, so like right up my alley. But I love dental materials, like finding how things work in the mouth and the different things you got to account for. Why do some of these things have to be kept dry versus wet? And like, I love that. I geeked out about that like nonstop. Like even in my downtime when I should have been studying like histology or something, I was like, well, let's look at dental materials. So I'll fully admit I love that class. Probably my least favorite for me was immunology, and a lot of that's just like there's a lot going on in terms of the immune system, and it was not for me. But it's a great class. It's important. It will absolutely lead into pathology and pharmacology and knowing how all that works. But that was a big struggle for me.
Okay, so it's been a little different for everybody. Very interesting. All right, Hillary, let's see. What is your least and favorite?
So my least favorite was probably oral pathology, just because I feel like every single tumor looks the same. So distinguishing pictures and what type it is, it's very difficult, but it is cool to see all the different pathology stuff that can happen in the mouth. And then my favorite class is probably local anesthesia, just like being able to anesthetize people. I think that is just so cool and so rewarding.
Very interesting. Across the board, very different. Okay. Well, we have about 5 minutes left, and I think I saw one more question come in. So good timing. So one of the attendees just graduated with an engineering degree and really like working with her hands and always been interested in healthcare. wondering if they had any advice about completing prereqs and the DAT before going through the application process. Does anyone want to take a stab at that one?
I'll go. So I actually, took my DAT in my gap year, which I got to be a stay-at-home dad. So granted, I had lots of time. I don't know, I was running after a small child. So how much time was actually studying? Some days I don't know. But so completing prereqs, really, if you did an engineering degree, there hopefully shouldn't be a lot left. Probably organic chemistry if you didn't have to take that one. And each school is different. So there are a few kind of consistent prereqs, but some schools will require like biochemistry, others will require anatomy. And so again, I'll shamelessly plug for you once again. The ADEA Dental School Explorer, like the book and stuff, has all of those prerequisites laid out. And so you can kind of look at what schools are going to require, and maybe if you just don't have a huge amount of time or money that you want to put into completing prereqs, you can kind of look there to see what schools might match what you've already got. And in terms of the DAT, again, it's a lot of the basic sciences, right? So it's the basic biology, general chemistry, organic chemistry, are the three big sciences. Then you have perceptual ability, which if you're an engineer, it's a lot of like 3D representations in your head. Again, probably my favorite part of the entire DAT. Had a lot of fun being able to spin things in my mind. And then math, which again, if you're an engineering, chances are you've probably covered that pretty well. And then reading, I guess, is also there. But the big thing there would be kind of look at what you need in terms of studying. If you feel really good about math, because you've probably done a lot of that in your engineering, but organic is maybe where you're not doing, you wouldn't feel as comfortable. Try to focus a little bit there. Definitely do like I'm sure they've changed since I've taken it, but like DAT boot camp was a big one for me. They have lots of practice tests. I believe I don't know if it's ADEA or whoever does the ADA has free practice, at least one free practice test, I know, maybe two, to kind of give you an idea of what the test would be like. And then, there's a myriad of different things that you can use to actually study, but those would be my recommendations on that.
Thanks, Dustin. Yeah, it's just to clarify there. I know it's confusing. It's weird. It's actually the American Dental Association who administers the DAT, which is weird. I don't know why it's on ADEA. Don't know any of that history. So, but it's, yeah, I think there are a lot of resources out there, and I think Dustin's right. And the advice I give to students, if you are confident in one area, spend a little bit more time in the areas that you're not as confident in. So does anyone else have any additional advice to share on top of what Dustin shared? It's okay if you don't, but if you do. Nope.
You pretty much covered it. Yeah.
Okay, great. Well, thank you. And the attendee says, thank you very much for that advice. Well, we are close to 6 o'clock, so I don't think I see any more questions coming in that we haven't already answered. So I just want to take this opportunity again to say thank you so much for people who attended, as well as our wonderful panelists. I've certainly learned stuff every time I talk to students. I learn a lot of stuff. So it's been beneficial for me. So I know it's been beneficial for attendees. I hope everyone has a little bit better of an understanding of, what, questions to ask if you're interested in a career in the dental professions. We're really lucky. This panel really provided a lot of different perspectives and different stories behind, why they entered either dentistry or dental hygiene. So again, thank you so much. This is being recorded. It'll be available on the HPW YouTube channel. And again, don't forget to check out HPW this fall, explorehealthcareers.org/HPW. Thank you all. Thank you very much to my wonderful panelists, and I will see everyone again soon, I hope. Thank you. Take care. Bye.